We're here again with Dr. Brad from Summit Family Dental. The question of the day is dental implants. Can you tell us a little bit, what is a dental implant to begin with?
So Rennie, dental implant is a piece of titanium, and for lack of better terms, it is usually a screw or looks something like a screw, but for someone that's lost a tooth and wants to have function restored, or even aesthetics, a lot of people are missing front teeth as well. And if you want to replace a tooth with something that feels like a tooth and looks like a tooth, a dental implant is the way to go. Dental implants go in and they stay in. They don't come out. They're not like dentures or partials. They go in and they stay in, and they look and act much like a normal tooth.
Now, can I ask if my tooth hasn't actually fallen out, is there a time where I think, where I would need a dental implant?
Sure. There's multiple cases where you might plan for an implant. A lot of times, people will be born missing, congenitally missing a tooth, a permanent tooth. They may have the baby tooth, but the permanent tooth just never developed. And that baby tooth is only going to get you so far. It's like driving a car on a spare tire. Eventually it's going to go.
Yeah.
So when that time comes, we can, take the baby tooth out and put in a dental implant and basically restore the function that you have lost with having a primary tooth. The other nice thing with a dental implant too is it maintains bone. So when a tooth gets extracted or gets taken out, bone will very suddenly start to go away. If there's no tooth root to hold that bone in place, it will start to go away. And the implant does act like a tooth root and keeps bone in place.
Well, so that sounds like it's good for your health, even beyond just, the health of your teeth and chewing, but just your general health to an extent.
Right.
Hey, can I ask, and I'm sure what folks are thinking about here is, what's that procedure like if I'm going to get a dental implant? What can I expect?
Yeah, so dental implant, it sounds terrible. It's a pretty relatively simple procedure. Post-operative pain is not usually very bad. A lot of people say, oh, it's going to hurt. And knock on wood, I have yet to have patients call and say, oh man, I'm in a ton of pain after this implant. Usually an extraction is much worse than getting an implant put in. So basically it usually takes about an hour and a half to place the implant. A lot of times we'll place the implant with a guide, which means there's no room for error, or significantly decreases the room for any error. And that way we can design the tooth first and then put the implant where we want the tooth to go, instead of doing the opposite. Back in the old days, we just put the implant in and try to hang a tooth on it however we could. Nowadays, we make the tooth first and kind of retrograde the implant into place.
I like how that sounds. It sounds like a lot more exact these days. So
yeah.
And, I know these guys have like state-of-the-art equipment in their state-of-the-art offices. So you really ought to check them out. Summit Family Dental, and you'll find them at summitsmilesiowa.com. Visit their website right now. Maybe set up a meeting with Dr. Brad or one of his other dentists there and get to know them and let them take care of your teeth, because they have all the experience and all the stuff to do it with. So thank you again, Brad.
Thanks, Randy.